Welcome back. Well, another milestone passed yesterday in the Covid-19 vaccine rollout. More than 12 million vaccination shots have now been given to South Africans. Just under 28,000 were administered yesterday.
Well, looking at that number, and the bottom number is not an international telephone number, it is the number of people worldwide who've received at least one dose of the Covid-19 vaccines available. That is around 5 billion people, which is effectively half of the global population. Of course, we know that that is not really representative when you begin to take a closer look at where in the world people have received those vaccinations.
Since the start of the pandemic, at the end of December 2019, 216 million people have been diagnosed as being infected with the virus. 4.5 million people around the world have died.
The number of new cases locally tailed off a bit at the weekend, with under 8,000 testing positive in 24 hours. 134 people diagnosed with the virus died in that period, bringing our total COVID-19 related deaths to more than 81,500.
There are 150,000 cases currently active. KwaZulu-Natal, the epicenter, with more than 62,000 active cases. Meanwhile, there's a potential new variant of the SARS-CoV-2 virus being picked up by local researchers. They call it a variant of interest. It was detected during genomic surveillance of samples during the third wave of infections. We're joined now by Dr. Jinal Bhiman, the Principal Medical Scientist at the National Institute for Communicable Diseases. Dr. Bhiman, good afternoon to you, and thank you for your time on the Pulse tonight. How different is this variant from the other variants that we already know about?
Good afternoon to you and your viewers. So, in terms of the differences, it's quite different from all the variants of concern that are currently circulating. There are some common mutations, but very limited number of common mutations between this variant or this lineage and what was previously circulating. And that's really what flagged our interest in and kind of raised the alarm a little bit for us. A couple of new mutations that are not seen in other variants of concern. So they're different, they're unique. So it's a little bit different, and that's really what raised the alarm for us.
Do we know if this variant is more dangerous, if it causes similar symptoms or different symptoms?
Unfortunately, it's very early days. So the variant was first detected in May this year. And we've had very, very limited number of cases that actually belong to this lineage. So less than 150 sequences that we've identified. So it's really difficult to make any kind of conclusions about pathogenesis and how its symptoms might be different from other variants.
I suppose that also means it's difficult to know if it's more transmissible than other variants. We know, for example, the Delta variant is more transmissible than others.
Yeah, same answer, unfortunately. At the moment, just too little data for us to make any hypotheses or even any statements about what is the real impact of these mutations. But in terms of transmissibility and in terms of immune escape, we have some laboratory experiments that are currently in progress, and hopefully we should be able to have some more information on this in the coming weeks.
And where has it actually been found? I mean, is it only in South Africa?
So it's been detected in all provinces in South Africa to date. And then it's also been detected in a couple of sequences globally. So some in England, Portugal, Switzerland, China, New Zealand, DRC, Zimbabwe. These are only really one or two sequences that have likely been detected in travelers.
So, I mean, would that mean it would seem most likely to actually have mutated or evolved in South Africa?
Yes, the evidence certainly seems so. So, if I can put it into context, this lineage actually arose from a parental lineage which is called the C1 lineage. And that C1 lineage was first detected in South Africa in our first wave of infections. And then it kind of disappeared with the beta dominance. And then we started picking up a few number of these cases again in January. And then in May, we've now picked up this new lineage, which is kind of like the descendant of the C1 lineage, but it's got many more mutations.
Okay, so just so that I understand it, I mean, I didn't do very well at science at school. So this came probably from the first variant that we saw, say, a year ago, maybe, well, more than a year ago now, rather than, say, from Delta. So it didn't go Alpha, Beta, Delta. This actually came from Alpha.
This actually came from before Alpha even. So what was kind of originally circulating prior to the variants of concern, and didn't really have much of a fitness advantage or selection advantage. It was just some of the variants that were circulating and that had diversified here within South Africa.
So if it didn't have a sort of a fitness advantage, in other words, if it didn't do better than the other variants, could that mean that it is not as dangerous to humans as, say, the Delta variant? Because if it were, it would be the dominant variant and not Delta.
So, sorry, I was referring to C1, which was the parental. That did not have, any mutations that afforded it a fitness advantage per se. But the C1-2 does have additional mutations. It has many more mutations than the Delta variant. And to date, like I say, there's just too few sequences, too little data for us to know if it might have increased transmissibility in comparison to Delta. At present, we're only detecting it at very, very low frequency, so less than 3% of the sequence data that we have. So Delta is definitely dominating still to date. But again, just too little data for us to say anything more.
Dr. Jinal Bhiman, thank you, Principal Medical Scientist at the National Institute for Communicable Diseases.